Zoe, thank you for attending. So would you like to tell us about what you do and the importance of these collaborative networks that you're trying to develop around climate change?
Yeah, great. I'll talk a bit about who I am and what our team does a bit more broadly, and then a bit about why I've come to speak to you this evening. So thank you for having me. I'm Zoe Garbett, the Assistant Director of Communities at North Central London CCG. I will probably use lots of acronyms, and I apologise in advance, so do just write in the chat if I'm using too many and I will explain them. But yeah, the Clinical Commissioning Group is the kind of statutory body that oversees the National Health Service, so the NHS locally. So we're responsible for the kind of strategy and the finance behind the kind of clinical services that you kind of receive and will be aware of in the borough. So we cover North Central London, which is Camden, Islington, Barnet, Enfield and Haringey. I know some people on the call will know this, but I think it's just good to contextualize it. So our team, as a new team, well, we're almost a year old, but a new type of team, and we're focused on health inequalities. So I come from a kind of psychology, public health, children's services kind of background. We've got like mixed experience in our team, and we're looking at reducing the inequalities across North Central London, which a lot of our time and energy goes into kind of trying to disproportionately get money into Enfield and Haringey, because we know that they've been kind of historically underfunded from a health perspective. And yeah, working with local authorities and working with community groups to kind of understand what's really happening for residents. So that's kind of what our team does more broadly. So as part of our kind of inequalities agenda and communities agenda, I've become responsible for environmental sustainability, which is really exciting for me because personally I'm a massive kind of climate and ecological emergency advocate. I do a lot. I'm involved in Sustainable Hackney, which is why I know about these kind of networks and the brilliant type. So I live in Hackney, but work in North Central London. But that's why I know about the expertise and the brilliant stuff that kind of people involved in these networks and the groups, that you guys will be representing. Just from my experience in Hackney, I know that often the expertise of the community groups, especially in this area, are often overlooked. We were totally like shunned by the council when we gave some opinions on their climate emergency a couple of years ago. So I want to start a kind of different relationship with you all in this kind of emergency, but kind of longer journey that we're going to be on as the NHS. So I think the NHS in pockets has been working on the climate and ecological emergency, but as a system only about a year ago set out that it would be the first health system to be carbon net zero by 20, like it's the only health system with that kind of goal, and their goal is to be net zero by 2040, but it's got some kind of goal that's for its direct carbon emissions, and then it's got kind of targets along the way. I think it's 80% by 2038. Hang on, I've got it on a slide here. Net zero by 2040, with 80% of that reached between 2028 and 2032, and then indirect emissions by 2045. But us as a North Central London system are trying to aim for the kind of lower end of all of those targets, as in trying to do things as quickly as possible. So yeah, so the NHS is responsible for 4% of England's carbon footprint, and yet October last year, Greener NHS was set up as a part of NHS England, so a kind of statutory part of the organisation, setting out the expectation across mainly kind of secondary hospital care, but also for primary care and for the organisation I'm part of, so the kind of estates part and the procurement money bit of the CCG, to set out how we need to address the climate and ecological emergency and the NHS's contribution to it. So this ranges from things like, well, you guys would be really familiar with all of this stuff. So like everything to do with the estate around kind of renewables, up to the way we purchase things. There's lots of activity going on around medicines. So inhalers are a large proportion of the carbon footprint of the NHS. There's lots going on around inhalers as well as anaesthetic gases. And we've got, so within North Central London, we've got a a clinical team. So the chief exec of the Royal National Orthopaedic Hospital is our kind of lead. And then we've got a couple of GPs and a kind of secondary care doctor all involved in the programme. So it's kind of led by quite senior people within our organisation, and we've got kind of high up commitment. So secondary care hospitals are all writing their green plans by January to show how they will meet this goal. And then I've got to pull together from all of those 10 kind of trust plans and primary care and our organisation into a big plan by the end of March. Obviously, that's what we're aiming for, but there will be a big programme of work that follows. So Francis mentioned there's a programme board that we've set up that's kind of managing this work, which Francis presented to last week on how to kind of engage with kind of civil society groups and residents, which was really good. And we're trying to use that group as a kind of building momentum space rather than a kind of monitoring space. We want it to be kind of the place where it's kind of a broad membership and it's kind of building that kind of enthusiasm and energy and kind of, you know, people are inspired to do things, engaging their workforce, you know, advocating to their senior leadership. And we're also kind of talking to chief execs and senior teams at the same time. So what I was talking to Francis about is how, and it's quite an open question, like how you all would like to work with us and how we can use your expertise and hear from you about, you know, as residents and as kind of advocates of your groups, what the NHS should be doing. And yeah, I had an idea that, you know, we're currently developing targets and a high level plan. And I wanted to give a window of a couple of weeks, maybe late January, early February. I haven't actually confirmed it yet, for you guys to see an early draft of the plan and kind of, you know, tell us where we could be going further or things that we've missed. And then the plan will go to the programme board kind of end of February and then through governance in March. And then we will have a programme of work which people are able to kind of be involved in or steer, or I can come back here and report on what we're doing. But yeah, it's very much an open kind of beginning, like we are doing things, but kind of, yeah, up for kind of thinking about how we can work together on this.
I mean, you told us the background. I'm sure there'd be questions, but maybe I could ask you a couple to begin with. One of the things, and we'll be talking about this later, that I was really, really, you know, concerned about and interested in, certainly when I did the presentation and when I talked to you, is you talked a lot about what the National Health Service is doing to become more green, to actually improve on its carbon footprint. But the thing I was saying is that at the meeting, and I'd love to get your response on this, is that the World Health Organization has said that the climate emergency is a health emergency, and the the IPCC, the International Panel on Climate Change, has said that local authorities, governments, organizations are not paying enough attention to adaptation. Climate change is going to happen. It's happening. There's carbon dioxide in the atmosphere. We're going to have 1.5 to 2.4 degrees if we don't go past tipping points increase. That's going to create huge health problems. And working with the National Health Service, working with you to look at how public health will be affected is really important. Now, is that something you think is important to focus on, Zoe?
Yeah, absolutely. Yeah, there's just so much to talk about on this, isn't it? And this is why I quite like to get to questions quite quickly. But yeah, absolutely. So Tamsin Ellis, who you've heard speaking, the GP who from Islington, who talks a lot on this agenda and has been to COP as part of Centre for Sustainable Healthcare. We're currently going around lots of kind of clinical forums talking about the fact that the climate emergency is a health emergency. And she's got a really good one slide that I can share with you if that's helpful. It's just like, you know, it will increase, you know, the heat and the weather and infection, and also the social, you know, kind of how it will increase and the issues that we already experience around social determinants of health. So absolutely, this is what we talk about in different forums. And after the conversation we've had, I have been thinking a bit more about the adaptation. There is a responsibility for secondary care to have adaptation plans, but the scrutiny of those probably could be stronger from NHS England. but we could do that locally. But that is going to be part of the ICS plan that we've got by March. Is it will include adaptation, because I think you're absolutely right that, yeah, we'd be foolish to not think about that as well.
Okay, right. Is there anyone else who would like to ask a question about how we can be involved with the CCG, with the National Health Service, from our own voluntary perspective?
Obviously, clean air, clean water, temperatures are health issues. And I just wondered if, you know, to what extent the NHS gets involved with organisations that are measuring air pollution, water pollution, and to what extent the increased temperatures in summer affect the number of hospital admissions and that kind of thing. You know, what sort of measurements and monitoring are in place?
Yeah, that's a really good question. So to take them in the opposite order, I know that NHS England is now, so I only know kind of the bit around sustainability. I'm sure that trusts are, you know, have lots of processes in place for kind of safety measures, but I suppose in terms of monitoring it from a climate emergency perspective, NHS England now do ask for kind of when temperatures reached an unsafe level. That's part of their quarterly monitoring. So we are seeing trusts report that to NHS England on a quarterly basis. So I think that increase in temperature bit is the one that's been monitored quite closely, but I don't know about their involvement in measuring air and water pollution. Obviously, as I said, they would have to do this as part of just general safety, but I don't know if they do it from a, I know that Gosh is really involved in, Gosh are doing quite a lot. So Great Ormond Street Hospital are doing quite a lot in terms of the pollution around the street and busy road outside of their hospital, because obviously they're a children's hospital and they've been working with the council to develop a kind of play street, and they've been doing some pollution monitoring. That's one that I know that is, but I'll take that away though. I think that's is a good point.
Hello, Zoe. We've met before at the CCG, and I wanted to raise with you the issue about inequalities. I know you're seeking to try to reduce inequalities, and that you've just identified and have before the serious inequalities we have in that inverted L shape in Enfield, particularly in Upper Edmonton, Lower Edmonton and Edmonton Green. And I want to raise the issue of the incinerator down there, because we have very, very high levels of ill health in that little part. Well, it's quite a big part and it's densely populated of Enfield. And we also have huge reservoirs. I've recently read a very unnerving report from a hydrologist that tells us that not only are people down there breathing fine particulates, but they're drinking them as well. I'm very aware that this is a little bit off your beat. I'm just using this opportunity because I think the last couple of occasions we met, I kind of nagged you about inequalities and the older people, because I represent on that group where we've met before, the Over 50s Forum. I just want to raise in this forum, just so it's raised, the problem that we have locally and its impact on equalities because of the terrible respiratory health down there of the incinerator. In other words, I just want to put it on the map.
Do you want to respond to that at all, Zoe?
No, absolutely. And I know that, I know that the incinerator, I know that there's doctors from the North Middlesex Hospital who've been campaigning against the incinerator expansion. I don't think it's something we're able to have. I don't know. I've raised it before about our position in the London with the London clinical lead around the health impacts of the incinerator in North, because it covers such a wide patch, you know, the North London Health Authority, Waste Authority. So it is something that we talk about and the impact, of those things being built in places that are already experiencing really kind of high levels of pollution. And it is something that Francis and I spoke about, the importance of speaking to people from that area and kind of, talking about their experiences as part of this process. But it's something that I can raise again in our organisation. But I know that, doctors at some of the neighbouring hospitals are already making statements about it.
Oh, I actually was just kind of wanting to ask about the incinerator as well, because as you know, time is kind of running out because Acciona are signing on the 16th of December. And I just wondered if there was something that we could do together between now and then. I know there is a doctor who's starting an action tomorrow. He's not in part of EnCaf, but he's starting an action tomorrow going on to Saturday. And then I think there's a meeting with various politicians on Saturday at the incinerator. And I was just wondering if there was something we could do together to add a bit more weight, because we've produced some flyers in some of the local languages to distribute in that side of the borough. But obviously the more weight we have behind our argument, especially if it's from a medical perspective, then the stronger it will be.
Yeah, let me take that back. I don't know what we're able to say kind of or do on that kind of, but I will raise it. I'll raise it.
All right, thank you. Thanks.
Yeah, hi, thanks. I just wanted to follow up on the point about climate emergency and health being linked, and to say that there's another group that I'm involved with, which is a tree planting group, experts in tree planting, and they had a really interesting presentation from South American countries and cities where tree planting programs is by a sufficient number of degrees to dramatically reduce their hospital admissions. So one of the things that I'm conscious of is that tree planting in Enfield is, well, if you look at where it happens typically in the nicer places, and the areas with the largest deprivation have the least number of trees. And it's easy to plant trees in green spaces which are already green, but I think it's really a health issue to plant trees in areas which are urban and grey, and the community should be pushing for, because it takes a long time for a tree to grow big enough to create enough shade to be useful to us.
Yeah, absolutely. There's lots that we're thinking about in terms of greening the estate that we're responsible for, and I don't really like that word, but like putting trees on the estates that we're responsible for, and kind of trying to focus those on the GP surgeries that are in kind of areas of higher deprivation that are less green. But there's something that we can do to work with the council on a kind of wider programme. Yeah, absolutely.
Okay, Tony.
Yes, thank you, Zoe. Zoe, I mean, one of the previous questions was about putting weight behind things, and what exactly can you do to get the CCG and the NHS to put its weight behind these very, very important issues, such as pollution and all the climate issues? And what's really required is pressure on governments and local authorities, and it's up to the CCG and the scientific side of things to increasingly put their weight and voices behind doing something about it.
Yeah, absolutely. And I think that's where I think kind of health professionals do come with a kind of, because they come from a kind of scientific background and do speak with a lot of kind of authority. It was really interesting to hear Tamsin's reflections on COP26 around the amount of space that was given to kind of health professionals at this COP, from there being like a few delegates at the one before to them having like a whole pavilion. And I think that just speaks to the amount of kind of, the gathering momentum of health professionals around this agenda, and the kind of clout that that this profession gets given on topics. So I think I think as as individuals and as bodies, we can be doing more, and I think it's something that there's like London level and national level organisations looking at this from the health perspective now. So I'd like to think that they're putting pressure on the relevant levels. But yeah, I can take that back as well to make sure that we're doing as much as we can as a CCG moving into the kind of integrated care system.
Yeah, sorry, picking up on the few things that were said. My approach to the incinerator is that there is a proactive effort to reduce further the issues of our poor air, particularly around those areas, but a proactive approach to actually reducing the quality of that air, which when you think about it, it's quite shocking. If we don't have air and we can't drink water, or have clean water sources, and we've had a lot of discussion recently nationally about the shocking problems with clean water and the fines that have been given. We had a lovely river talk, and by Extinction Rebellion and other members came along too, about our own new river, and there has been no checks on that apparently for at least 2 years by Thames Water. These things, air and water are very valuable, but also the third thing I thought I'd mention is woodland trusts at the moment. On just our allotment, we've planted God knows how many trees of different types, which is very important to plant different types of trees, and what types of trees are important, obviously. But from the Woodland Trust, so they've got a huge bank of they're only saplings, of course they are, but I think one of the things we as people in the borough who are watchers of these things could possibly do is really watch to see which trees have been cut down and why, really be sharp on this, because these huge trees are very valuable, to mitigate carbon, and we've got to get smart about developments as well with, the electric connections that planners should put in, all these different things, for people in their living habitat. And I just thought to say that anyway. I think it's very important to go hand in hand with not just the incinerator, but the other things, issues that add on to these poor people who are stuck with this issue immediately. But we all are actually, because it wafts out in the air. It's not going to be static. So it's less recycling, better quality of our recycling as well, and a real push to stop corporations from. I went in to look at some of the toys. It's all plastic. It's really, really difficult, to get away from this. And it's much more plastic than it ever was before, these industries. So we need to look at these industries because they are the things that are creating, age-related plastic things that, if they don't get handed down, they get thrown or broken. So I think it needs a really good think about, getting these pieces together and trying to form some sort of, identity with them, rather than just one attack, but several prongs.
Okay, Mary. Obviously, you said you're going to take that up, Zoe, and about the incinerator. Dave Cockle said, by the way, that EnCaf did a land use report, which was really, really good, and they identified a number of open spaces in the east of the borough suitable for green space and tree planting, and that's really, really great, because a lot of the evidence shows that where there's green space and where there's trees, health improves in those areas. So there is a direct link between that and what the health authority does.
Hi there, that's really interesting, Zoe, to hear about your work and the link between inequalities and the environment. I'm a member of the EnCaf core group, but also chair the People's Health Trust that puts lottery funds into the areas that have the greatest health inequalities. So what you said is sort of music to my ears. I've been wondering about Enfield and some of the things that we know are causes of ill health, like air pollution, water pollution, poor housing conditions, and how you can provide us with data about the health levels of different parts of the boroughs that we could then tie up to the causes of ill health. For example, we know that there's very, very poor monitoring of air quality in the borough. What we do know is that it's poor, but tying that into asthma and respiratory diseases and cardiovascular disease would help show that this has a cost to the well-being of local residents and to the NHS budget. Likewise with poor, damp, cold housing conditions and the impact that has on health. So I was wondering what you're using at the moment that will help you track strategies to reduce health inequalities and how we can tie environmental data closely to that.
Yeah, that sounds really exciting. So we do have, there's a kind of group that we work through called the there's an inequalities delivery group that we work through that does have a lot of kind of data on those bits that you've mentioned. But I think that marrying up around the environmental bits we haven't done. So yeah, if we could do some work on that together, that'd be brilliant. I'll dig out the stuff that we use, and then we can have a look at that and see what we can do about marrying it up.
Perhaps we could follow up after the meeting, because in the People's Health Trust as well, we're trying to do some of that with NHS nationally, and we really need to tie that down as another set of evidence of where those predeterminants, the social determinants, have got to change because they're impacting on all of us and our health and well-being.
Okay, and maybe we should take that up, Jenny, in the core group, because that's really important too.
My point was really that local authorities' health really need to be role models in all of this, don't they? So we're talking about the Edmonton incinerator, but what about hospital incinerators? The amount of waste and rubbish that comes through hospitals, plastics, wet wipes, all of these things. Procurement by hospitals is huge, and requirements in procurement for things to be made that are going to be less polluting and polluting of the air and the water for that matter. Can you say anything about that, Zoe, of what is actually happening on the ground in health to be role models for better heating systems, this kind of thing?
Yeah, I think again, it's like there's pockets of some good stuff happening. So like some areas where some trusts or primary care kind of practices have done some really great stuff around kind of reducing glove use, like reducing kind of mask use and using like reusable masks. In the middle of the pandemic, the Royal Free kind of commissioned and purchased washable gowns, and then they, and it was done at a kind of local by a local provider. So again, that's like kind of all those wider good points around kind of local jobs and less travel and all that. But it's a huge area, and I think that's where, so I've been working with the kind of strategic procurement people within the CCG and the procurement leads for the trusts to do it at scale. And I think this is where this program is going to be really helpful, that we're kind of taking the learning from all these various parts within North Central London, as well as kind of in other areas of London and the country, to kind of try and scale up. And obviously the pinch point that we're getting to, which we've got finance and kind of senior leadership on side, but a lot of these things are going to cost more money. And I think it's in the next couple of months that we really need to kind of, finalize and get that approval that we are going to go for this at whatever cost in the short term, because we know that the gains in the longer term will be huge. So all those bits that you've identified, I think, are happening in pockets, but not at scale at the moment. But I think the plan that we're developing will showcase those, and then we'll talk about our kind of longer term kind of ambition.
Yes, sorry. Some years ago, I think probably 4 or 5 years ago, there was a joint strategic needs assessment produced by the NHS and in conjunction with the local authority, and that contained a large amount of statistics on what sort of problems people are suffering with and what was going to happen about it. I think it probably is still around, but it would be nice to see this updated and brought so that they could bring into it the impact of climate change and the effects of things such as pollution. I think if that was available and just updated to bring in these issues, I think that would be very useful for local people and for the health authorities.
Yeah, that's a really good point. Yeah, we do work closely with public health, so local authority public health teams and some other parts of the local authority around a lot of this agenda and through our wider inequalities work. But that's a really good point. I don't know where they are in terms of updating that, but it absolutely needs to consider. It would be great if it, really highlighted these issues like front and centre. So yeah, I can pick that up with public health.
That's great, Zoe. And I mean, we're going to work together, I hope, a lot with EnCaf and with the other groups as well. And I'm sure we'll come up with some really good ideas, and we'll talk about what Jenny said, particularly because that's quite important about getting all the information together. I'll be doing a webinar with Zoe and the GP she mentioned, Tasman Ellis. I think it's next week we're doing it, where Tasman talks about the relationship between climate change and public health. And then Zoe has a chance to talk a bit more about what she's done today about the creation of collaborative networks. So we'll have a webinar on that as well.